welcome back to the morning show here on Arise News. The Nigerian Center for Disease Control and the Presidential Steering Committee on COVID-19 have warned that Nigerians need to pick up the habit of adhering to existing COVID-19 protocols, following reports that cases of the virus could be on the rise again, against the backdrop of development in faraway China, which recently relaxed strict protocols. Joining us now to look at this matter is Professor Oyewale Tomori, renowned virologist and member, Global Virome Project Leadership Board. Professor Tomori, the chairman, Board of Biovaccines Nigeria Limited, is also a member of the World Health Organization's think tank on COVID-19. Good morning, Prof, and Happy New Year to you.
Same to you, Steve and Oji. It's a pleasure.
Thank you so much. Thanks for joining us. Well, it's looking like the worries about COVID-19 are back. Prof, is this just about China not cooperating with the world, or is there something else to worry about, given what all the restrictions that many countries are now imposing on China? How worried should we be, and are we ready to confront what might likely happen?
Thank you very much. Contrary to what we're being told here, I think we should be worried. I don't think what is coming out of the NCDC and the steering committee is gearing us up enough to do what we need to do. There's a problem in China. It's a global problem. And all those countries that are picking up those things, they must have good reasons. And the reason for that, they are testing, they are monitoring, they are getting details of what is happening. You remember Italy reported two plane loads of people coming from China. 50% of them were positive. What do we have in Nigeria? Are we testing people? Do we know who is coming in? We got our NCDC told us that 35 cases, but that was for the last week of last year. What are the figures for now? We don't know. Of those 32, of which 22 came from Abuja, likely, how many of them, do they have the travel history? Are they people who are just in the country, or people who have just arrived? Those are the detailed information that NCDC should be giving to the people, so that when they make a decision, we know that those decisions are justified. If you have 22 cases in Abuja, where are they from? Are they recently traveled people? Or are they people who came in from outside of the country? These are some of the things. When you give people incomplete information, then of course they don't trust what you are doing, and then you don't have confidence in whatever decision they are taking. You want to be sure that all that information is available to the people and up to date. You can't be giving me data for last week of December, still 35 cases, and then what about now? How many do we have today? How many do we have last week? That's what other countries are doing.
Yes, you are absolutely right. Countries like the US and China and Japan, as well as India, have taken precautionary measures against this resurgence of COVID. Now, I'd like to know how it can really affect Nigerians, given that the federal government, like you said, is mulling the restriction on arrivals from China. Last month, China said that it will scrap quarantine measures for inbound travelers from today, actually, January 8th. The country's National Health Commission said that inbound travelers will no longer need to quarantine, but they'll, however, be required to undergo PCR testing 48 hours before departure of flights destined for China. Now, what does this say about the new strain of the virus, or wave, or resurgence, or what you might call it? If since March 2020, all passengers arriving in that country had to undergo a mandatory quarantine, but now they don't. What does this say about the new resurgence?
Let me say one thing. Travel restrictions start from total travel ban, or some of those things we're putting in. Nobody is asking Nigeria to ban people coming from China. We're saying up your surveillance at the entrance. People are using rapid tests now. Nobody is waiting for PCR, come back 7 days to do that. Rapid deterrent tests are now good enough to be used on arrival. So we know those who have it on their arrival, and then we can put them in isolation. These are what we're telling our government to do. Get the RDT in place at the points of entry. Whoever comes in, first of all, you must come in, like other countries are doing, with a negative result. Even with that, I will still test you over RDT on arrival. That within a moment, before they even leave the airport, I know who is positive and who is not got positive. Of course, we will miss, because the outreach is not perfect. We miss some people, but we get some people. And then those of them who come in, I think we give them some time and say, look, yes, though you are negative, but still be monitoring yourself, so that we can be sure that if you have any of these diseases, then any of these symptoms, then we can then get you up into place in isolation. So those are the things we need to be doing. Now, as to the question whether with this, we don't really know what exactly is happening in China, because China is not giving information. And that's what WHO have been complaining about. There are stories coming from different sources. There's a lot of people are dying, but we don't know. China is not saying, and nobody is saying. So it's better to be on the safe side by putting your borders on alert. And I think Nigeria should wake up. And I mean, in spite of what the NCDC is saying, as they say, look, we don't have up-to-date information. We need up-to-date, real-time information about what is happening in the country. Telling me what happened last 2 weeks ago does not help the problem.
Prof, why do you think the Nigerian government is reluctant to, be proactive about putting up certain restrictions for people coming in from China, as many other countries are doing? Does it have to do with the level of, business and bilateral relationship that we have with China? Could it be about the fact that because Chinese entities are involved in many developmental and infrastructural projects in Nigeria, that it could lead to a case of, because there are restrictions, we may not be able to come or complete your project on time? Could this be the reason why Nigeria seems to be hesitant? And what would be your specific advice at this point?
I think it's a combination of factors. First of all, let's look at our country. We have a basic problem with being proactive. So it's not against China alone. On many other issues, we wait until the thing has become a problem before we act. So we're just being reacting to type. It's not in our nature to be proactive and to look at what is going on. We wait out everything is a problem before we start running helter-skelter. So that's number one. Number two, I think Nigeria is not trading only there. It's true. A lot of Nigerians go to China to go and get all this information. I think part of the thing is the fact that the people who are in charge of this situation, I don't think they are, sorry to use the word, I don't think they are serious enough to look at the implication of what is happening. And as I said, they can only do that when they have good, up-to-date data, which I don't think NCDC is providing. And that's my worry. I think we go back to that issue. If you convince me with data, if you tell me so many came into the country, they all told us there's no no variant from China detected in Nigeria. I use the word detected yet. And I asked the question, when did you test last? How many of the samples in those ones have you tested for sequencing? How many have you sent for sequencing? How many labs are sequencing in Nigeria? We don't get that information. So when you don't give me information, I don't know what is happening. And therefore, we reach a situation where we don't even trust what the government is doing. If they want us to be involved, the public to be involved in this, they should give the public the right information that will make public to take a decision. It is my life. And therefore, if you tell me and give me the data that required, I say, look, I'm in danger, I will probably go along with you. But when you hold the information, when you give me half information, when you give me incomplete information, then I don't believe what you're saying. And that's the problem I think we need. So it's a matter of one, the Nigerians' nature of not being proactive on emergencies, number one. Secondly, doing things according to emergency when the thing has become a problem. Now we start running helter-skelter. Secondly, I don't think the government agencies are doing enough and providing enough data for those people in government to take a proper decision. And I think these are some of the areas. Yeah, of course, you cannot knock out the fact that a lot of Nigerians go out to China to go and trade and all that kind of thing. But then when COVID came, well, we're not alive. I know our economy has gone down, but now China itself has opened its doors and said everybody can go where they like, and you can come in and so. But I don't think that's the major reason. The major reason is that basic thing in our country that we never proactive on issues like this. And secondly, that we don't give enough data for people to take appropriate decision.
All right. So in your experience with COVID, what do you think that the federal government should do first, besides the fact that you're talking about providing data and all of that, in terms of, protecting its citizens? Now, you know that China has also said that the country's management of COVID will be downgraded to category B from the current level, category A that it is right now.
Yeah, each country has its own plan. China decided to zero COVID. That worked briefly because they had quite a low number, but then it can't work forever. In addition to ensuring that COVID, there are other issues that we need to do. So back to Nigeria, our first reaction would be up at the point of entry, because the likelihood that where people get this will be there at the airports. We don't have too many that bring in people around side, Abuja and Lagos. Increase your surveillance at that level. Ensure anybody coming into this country from those country or China or other places which are the hotspots, make sure they have their zero negative test when they are coming in. Test them on arrival. And I keep saying that one. We have a system here, we say come back 7 days, and that doesn't work. Test them on arrival. And then you can, within a short time, even before they get out of the customs, you can actually, know who is positive or who is not positive. Put those ones in isolation. Tell the rest who are negative to please monitor yourself. If you have this, if you have this, please report to us. It requires the cooperation of the public also. But then public will cooperate with the government when the government itself is open, which is information. And these are the priorities. So get our borders back on this. Anybody who is coming in from China or the related area, you test them on arrival, having assured that they came in the first place with negative result. And then those that are positive, which you can do right at the airport, make sure that they are put under isolation, and the rest we give them within the period 7 days or whatever, and say, look, keep monitoring yourself, cooperate with the government. It's your life, it's my life. Secondly, there was one other issue that was saying, how many of the people we say we have no Omicron, we have no variants coming into the country. We need to get our laboratories. There are still 7, 8 of them who have ability to sequence. Let them all let NCDC coordinate the activity. I use the word coordinate, not control the activity. Coordinate, make use of all the facilities we have in the country, send all these samples out, and within a short time can know whether we have these variants in the country or not. All they say is that we don't have yet. Who says whether we don't have? Later on, in many of the cases, we are detecting those things 3, 4, 6 months after they have arrived in the country. So it's the same situation. So we need proper coordination of these sequencing activities, 7, 8 of the labs, and NCDC coordinating, not controlling. The controlling we're doing is that all samples go to NCDC, and that's why we're having the problem we're having.
Okay, Prof. Omicron was the last variant that we dealt with, at least publicly. Do we have an idea of what we are dealing with now? The variants that are coming in. Has any been, identified or isolated, and are they known? If they are, how should the public react beyond the fact that, yes, the authorities concerned should give adequate information? But then if you do contract COVID and you do come down with the illness, what variant will they be dealing with, and what should the public be aware of in terms of, managing yourself, in terms of treatment, in terms of, everything that is necessary, all the protocols?
According to NCDC, the variants they know we have been the ones we've reported. They've said no, they have not detected any of the variants from China yet. They just said no variant from China has been detected. And I use the word yet. We need to remember that. So what we need to do, it doesn't really matter which variant you get. The point is that you don't want to get infected with anything at all. And what we need to do is to, as we said, monitor, get all of this together, quick information to our people, let them know what is happening. And whether you are suffering from the past Omicron or you are suffering from the new one, of course, the symptoms may differ. The point is that you don't want to get COVID at all. And so get that information to our people on how to prevent themselves from this. I know in the last thing they mentioned people like us who are older than 65, who have comorbidities, should still continue to wear a mask wherever we go. We still continue to wash our hands. That message should be repeated on and on. Remember, what is the vaccination? And then get people vaccinated. By the MPHCDA data, large number of people who need to be vaccinated. So get out the information. Go and get vaccinated. If you need a booster, go and get your booster. And so many other things, particularly now that we're dealing with the issue of something we don't know. And like I said, the answer to that question is that we don't know what we have in the country because we are not up to date in our testing, in our sequencing. And that's where we are. So we're living in ignorance. We're responding blindly. And we're responding like a deaf group of people who don't know, not because we can, but we have the facilities, but we're not making full use of the facilities we have to get the result that we deserve for our country.
Okay, Prof, this is still, if you like, a flu season. From December up till now, mild cases of harmattan here and there. What's the medical circle tracking at this point as regards what many people are complaining about in terms of resistant malaria? I know quite a number of people who are saying that they have had to treat malaria repeatedly within a month or two, sometimes twice or thrice. Are we dealing with a variant of what we might not know? Is there a connection at all, between the flu season, malaria that seems to be resistant, and the COVID that seems to be coming in at this point?
Thank you for that question. Other countries in Europe and others are actually doing what we are saying. They are checking all the cases. They are separating those who have flu from those who have COVID, from those who have other things. And that's where your laboratory becomes very important. You cannot do that by mere symptoms. You need laboratory, well-established laboratory to do that kind of thing. Those countries are able to do that separation because they have this. We don't know what we're having in Nigeria, whether it's flu, whether it's COVID, whatever. Or is malaria, because our laboratories are not there to let you know what it is. And that's one of the major problems we are talking. Remember when we started with COVID, Nigeria said we had only 2 or 3 laboratories that could test COVID. Then suddenly we upped those numbers to about 100 or whatever. Today, go and check how many of those labs are functioning. Only about 50% of them, NCDC puts it on their website every day, every week, that the following labs are either not reporting or they are not testing. What's the essence of putting up 100 laboratories when in the next year 50% of them are not working? When the next epidemic comes, we come around again and say only 3 labs are capable of doing that thing. What has happened? Why did we go? And this is why we need to learn about laboratories. Laboratory is not just putting up the building. Many of the states put up all these laboratories because it was another opportunity for contract and to siphon money. Building laboratory means you build, you equip, and you train the staff. Many states were building, they did not equip. If they equip, they will not staff. And that's why 50% of them are no longer functioning. We need to monitor and ensure that when we don't need 600 laboratories in the country. Polio eradication was done with just 15 laboratories in the entire African region because there was time for sustainability, you fully equipped them, and there was access. So there's no need having 100 laboratories when 2 months later, 50 of them are no longer functioning. And that's the situation we're running in the country. We need to learn to get our laboratories to function, to sustain them, equip them, provide them with reagents, and make sure the staffs are properly paid. That's what we're running into. And that's why you and I cannot tell you whether it is flu we have, whether it is COVID we have, or whatever. The same NCDC gave us information about Lassa fever. This year, the number of Lassa fever for last year was double the one of last year in terms of suspected cases. But when you look at it, we're only able to confirm 10% of all the suspected cases. What are the others? We don't know. That's where the laboratories become very, very important. We put our resources in it, and we can solve a lot of our problems by having good laboratories that will tell you this is that. Then you know what to treat, and you know how to respond.
All right. Thank you very much, Professor Tomori, for joining us on the morning show and for your insight. Thank you so much indeed.
Thank you, OG and C.
Thank you, sir.